All right, hey, it's Dr. Craig Hazel here from Synergy Chiropractic in Kanata, Ontario, and I'm here with Patricia, and we wanted to share something pretty awesome with you. Patricia, maybe you can tell people just in a quick 1 minute what sort of things you've been going through in the last years.
I've been chronically ill, let's say, for over a decade and have been the subject of a lot of conventional medicine, some of it very helpful, some of it not so very helpful. And why the reason I'm with Dr. Craig now is that due to a post-operative issue involving the nerves and nerve damage, I was at the end of my rope with all of the conventional options that were out there, and so were my family, because we can't forget the caregivers out there. And so I came to Dr. Craig at the insistence of my sister and family who love coming to Dr. Craig. And I watched the video that he sent out, and I said, you know what, we're going to give Dr. Craig a chance. So that's why I'm here today.
Cool. And just, do you mind if we share a little bit about your history there?
Go ahead.
I mean, some of your history was such that you've had just unrelenting nerve pain down into your leg. You've had the neuropathy where you just can't even feel anything in your foot. You've had trouble with walking, trouble with balance, trouble with coordination. Post-surgically, you've had some troubles within some very specific areas that have given you a lot of grief with bladder issues.
Yeah.
You've had chronic migraines and headaches and just chronic fatigue issues. Have I missed anything?
Well, a lot of the bloating, and like you say, a lot of my organs were actually going into shutdown because of the fact that my bladder wasn't working. It was sort of backing up in my system, so I was being poisoned basically by my own body. So.
And again, you had mentioned to me that you had started taking some medications, and come November, December last year, you actually went and bought a headstone because you didn't think you were going to make it through Christmas.
Yeah,
That
was my gift from my husband, and I married an older man, so it was supposed to be the reverse, and he thought it was very strange, but that's what I asked for Christmas. And my mother, who's been a nurse for over 50 years, agreed that I should do that. So it's out there now, but I don't think I need it right now.
The good part of this, we just saw you on Tuesday.
We sure did.
And we saw you yesterday.
Yeah.
What did you notice different?
Immediately, I feel like right away I got my life back in the sense that the neuropathy, and I don't want to jinx anything, seems to have disappeared from my foot. I can feel all 5 toes, right down to the little piggy that went to market. I can feel socks on my feet, and I can sit. I'm sitting right now. I haven't sat in months. A lot of
and you're not on your cushion because you.
I always have my cushion. I'm not even on my $500. Thank you, OMS, for my cushion, $500, and now I'm calling them to say, come and get it.
Yep.
And the best part of today is after only 2 appointments with Dr. Craig, I drove myself here. That might not seem like a lot to a lot of people, but I'm a type A workaholic. I haven't worked in over a year. I'm very control. And my husband was like, are you sure you want to drive? And I drove here myself.
When was the last time you drove?
We can't even remember. It's been at least, I think, 6-8 months or so. So we can't even recall. So it's a long time. And even then driving, it would be out the laneway, and then I can't drive because it's just not morally right, you know, because I can't feel my foot. So then my husband would take over. So to be honest, it's been well over a year.
And you slept all last night?
I slept for the first time in multiple years. I went to bed early, like I normally do. I read and everything, so I got caught up in reading. But then at midnight, I turned off the lights, and I got up at 7, and my mother, who's the nurse, always checks on me. She goes, you didn't call me at 2, you didn't call me at 3, you didn't ask about what drugs it take to go to sleep. I didn't call, and I slept.
That's awesome.
Yeah.
And you told me the other day that usually you have to have a 3 or 4 hour nap in the afternoons.
Fatigue, yeah.
And how's the naps been?
The naps are less. I always wonder if it's just I'm so excited about seeing you and finding a, but also, no, there's been a resurgence in energy. Because even my husband laughs. He met me when I was 25. He's like, there's my 25-year-old bride. He's like, what are you doing? So yeah, so he's got me back. So. And that's another thing. I mean, we talked with Vic, and I mean, the relationship side of things, that's been a challenge because, again, it's hard to have a solid kind of focused physical marriage, even, you know, because he's trying to support you. So we're looking at lives being changed because you're starting to get bored. Absolutely. And all the caregivers out there, to all of you who are caring for somebody, you know what he's talking about. It robs you of a lot of your life, and you feel helpless. I see it in my mother's eyes. I see it in my husband's eyes. So this gives them their life back as well, which is important to me because I don't want to be so codependent on others. So already after 2 sessions, I'm not. Thank you, Dr. Craig.
Unbelievable. And this is just simple understanding how the neurology of the body works, making sure that we're removing interference. You did all of it. All I do is remove the interference. You do the healing. That's the way your body is God-given ability to be able to heal, to function, and that's yours, and that's your birthright. So we wanted to share that with you. We're going to come back to you with another update in time as we start to get Patricia even better and
Oh my
even
gosh.
greater.